Hello, please come in. I was wondering when you would come. Please sit down. Okay, you look absolutely incredible. Yes, your lips, amazing. So it is visible that we have done quite a bit. We have done a good job on your face, but it is also very apparent that there is quite a bit in front of us still. Yes, so I'm guessing that you have come to address your nose, your chin, also your cheeks, because we have done your forehead and the eye area. Okay, so also on top of that you have jaw problems. What kind of jaw problems? Okay, so you're experiencing some tension in your jaw. Okay, and are you experiencing any other issues relating to the jaw pain, like maybe some headaches, difficulty opening your mouth or something like that? Yes, so you are. Okay, that's and does it radiate into your ear or something? Okay, so that might be an issue with the temporomandibular joint, which is somewhere right here, because this is os temporalis, this is your temple, and this is the mandibula, this is your lower jaw. Okay, and what happens is we have a muscle called the musculus masseter, and when you are experiencing an issue with the joint, we have to try to relax the muscle. Okay, is that understandable? What I don't see on you, which is quite usual for people with this condition, is they have quite a square jaw, and with you, I don't really see that you would have a jaw line at all. Yeah, but it's nothing personal or nothing to insult you or something. Can you turn to the side? Yeah, I don't think. Yeah. So what would happen is you would the muscle would expand, and it would look like you have a very square jaw, which you don't have. It's okay. It's not a condition. I'll just look for your card. Okay. So we have here the picture from last time where we drew on your face and what we have done. So we have already done your forehead and your lips, so we don't need to do them right now. So what we will focus on, okay, today to alleviate your jaw pain or the bruxing, it's like when you grind your teeth or you clench, the grinding is bruxing, which can cause the pain in your jaw. Sort of this. Yeah, so I am a little bit too high, sort of like right here, and here you have a muscle. See, like that, on both sides, of course. And what I would recommend for you is we would inject some Botox, which is botulinum toxin, into the muscle, which then the muscle then doesn't react to your nervous system, and you stop clenching, you stop grinding your teeth. I think you could benefit from that, but I don't want to really abandon the idea of us doing a little more. As I said, your face is it is there, and it needs a little bit more done. Okay, so you are one of the people who their face is just all over the place, and we try to manage it, we try to mend it a little bit. Yeah, of course, this is nothing to insult you or nothing to take personally. I'm just trying to be objective, and the objective truth is often not the most kind. Okay, yes. All right. So, what I want to do is also have like a little bit of filler, like right here. Okay. And what I would do is, as I said, you have a huge bum. Okay, like right here, bump, like. And if we put a little bit of filler in here, then the nose can look a little bit more even. I wouldn't want to give you the ski slope, we have talked about it, but I would want to give you like a more straightened look. And also with the jaw, so we talked about, we would put a little bit of filler in there as well to balance out your features, because you are very prominent, you know, from the profile, and we will try to navigate that. All right. Yeah, it's just, oh, you don't like the needles. Well, you see, it's fine. You are afraid about the needle in your muscle. You see, you have seen the needle. It's quite small. Okay. What is the most important with needles is when they have a very thin, and the needle is thin on the syringe. So we don't really need to numb it. By how thin the needle is, it just slides under the muscle, and it is inside the muscle, and it is done. It is injected and it's done. I always think that you have to take a look at the bigger picture. Alright, you have two options, you know, and one is the chronic pain of having the jaw tension, having the, you know, the headaches, the bruxing, and all of these like dental issues, of course. And the other side is getting a little needle poked into your cheek, and that is done. The pain from the injecting is temporary. On the other hand, the pain from the actual TMD, when you have this temporomandibular disorder, that is chronic. That it's not just in the moment, it is on a prolonged period of time. Alright, so I'd like to take a look at you again, especially at your cheeks, and the light will be very bright. At your cheeks, and then at your nose and your chin. Okay, so did you start using like SPF or any skincare that we have talked about? Not really. Yeah, I can tell. You see, you cannot hide it from me. I see it all. And I don't like it. You really have to start using some sort of skincare. I would, if nothing, at least SPF, right? Sun protection in the morning, factor 50, like at least 30, but in my opinion, factor 50 is the minimum. But is 50 plus. Okay, so you have a lot of hyperpigmentation on your forehead, alright? Which is something that you should maybe talk about to your dermatologist, because the face is always exposed to the sun, and it is a place that we really, really want to protect. Yes, because things like melanoma are things that are very malignant and very, very difficult to get rid of. Okay, so I don't want to just address your skin, all right? I think that's not what I would want to do, or not what I am here for. Of course, obviously, I am here to take care of the wrinkles that you have, and you have many. Yes, not on the forehead, which is obviously the direct result of our last appointment, but turn it on. Yeah, but also on your cheeks, and as I said, you have quite a deep frown lines. Yes, so you keep frowning. I don't know, I don't know your life. Maybe if I had issues of yours, I would be frowning more. Yeah, but we really try to frown less. It doesn't look good. Smile lines look better. Frown lines, they just look sad. Yeah, I see that and I get sad. And I wouldn't even say that I am that of an empathetic person, but it's sad. So what I have here is a measuring tape. You have seen it before. It's great. It is done to measure. So I'll take some measurements of your cheek and sort of figure out what I want to do. Also what I want to do with your nose. I know I have measured it before, but it... Yeah, okay. So your face is quite long. We have talked about it. There is nothing really I can do with the length. Yeah, I cannot cut bones to, But what I can do is definitely work on that bump on your nose. Okay. But it looks good. Yeah, I am very satisfied with the cheek. Or no, sorry, with the forehead that I have done on you. Also the crow's feet. Do you still squint? Oh, you got glasses. That's good. That's good. Don't squint. It's not good for you. It's not. Okay. So I will just start with the TMJ. It might hurt a bit. Okay, I'm not going to lie to you. It will hurt because it is a needle into your cheek, into your muscle. Okay, but again, try to think about the chronic pain versus the temporary pain from the injection. Okay? So I have a few things. So I have the Botox. I'll mark it up on you. So sort of like right here. Right here on that. And on this side. Like this. This is the muscle that we are addressing. This is the masseter. Okay. Like right this, like this. to the side. Okay, so sort of on the nose, like this is the butt. So like this. Okay, and could you lift your chin up a little bit? Yes, I see it's very unbalanced, so I would put a little bit of filler in there too. Okay, a little like right here. Okay, looks good in my opinion. Let me see the size of your chin. That's a large chin. I have said this before, sorry. I've told you about this before, that you are very gifted in the area of being very both vertical and horizontal. Yeah, being very spacious. In the past, they would love you in like a theater because you have, as I said, a canvas. I don't even need a magnifying glass for that. So they would love you because they could see all your expressions, and you have many, and just the wrinkles around your mouth are a witness to that. Yes. So it is very important for us to address the headaches and the issues that are related to that though. So I'll just put on gloves. I have blue ones today. So how are you in other sense? Like how are you when it comes to how was your day other than the pain, the headache? Yeah, okay. So you are very satisfied with the lips. I like to hear that. You see, sometimes things like this are a lengthy process. Okay, some people come in once and it's okay for them. Some people have to come in 5 times, 4 times to get the results that they desire. Okay, but let me feel around your face first a little. Okay, so I am feeling your chin. Okay, it seems like it's a good place to inject. I'll grab your mandibula, your lower jaw. Okay, can you open? And close. So the opening is worse. Can you do that again? Okay. So opening your mouth is a little worse than closing it. Let me just take a look at your teeth. Keep your mouth open. They look a little filed, from the waxing, from the grinding. Do you grind in your sleep, or or even do you cut yourself during the day? Okay, because they do look a little bit filed. But your main concern is with your headaches. Okay. You can close. I'll just take a look at your forehead, what we done last time. Okay, I like the forehead. Can you raise your eyebrows? You can't. Okay, that's good. And your crow's feet. Yeah, they look okay. Everything looks good. Your nose. Can you turn to the side again? And to the other side. Okay, it all seems great. I am satisfied, as I said before. I am satisfied with the work we have done before, but we do have to address the issues that we are facing today. Okay, so what I need is a little bit of, I need a cotton pad. The cotton pad. just to disinfect the area. Yeah, keep your mouth closed. So like this, and we will inject straight into that. So it's a needle, as I said. The needle is not very large. It's, as I said, think about the pain being only temporary and it helping. It will hurt. I am not going to really lie to you, but it will hurt less than having chronic issues. Okay, you're fine. Can you breathe in? Great. And breathe out, and now you'll feel a sharp scratch. Okay, that's okay. I know. Can you breathe in again? I'm going at a different angle this time. Breathe in and out. Okay. Okay, that's fine. That's great. Just keep breathing. Keep breathing. And the last one, breathe in and out. Good. Good, good, good. Yeah, it hurts. I'll hold this on. Yeah, just keep breathing. That's the most important. That's okay. Yeah, I know this one might be one of the most painful we have done. You know, yeah, it's not easy because this is more medical than cosmetic, and it is right into the muscles, so it hurts, you know, but we have to power through and think about the future. As I said, it might get swollen a little bit just because we have injected into your system, and the system doesn't like that really, but your system also does things like causing you pain, like headaches, so we have to put it in line with some help. Okay, we can do the same on the other side. The side, you just have to breathe in and out for me, and everything will be fine. You just have to maybe close your eyes, but please don't tense up. Just close your eyes and breathe, and I will try to be as quick as possible. See, yeah, I know sometimes. Yeah. So, as I said, you don't have the strongest jaw. Okay, so I'm wondering if maybe one day we could make your jaw a little bit less, you know, like when it's like weak. Okay, I'm not telling you to have like a Cillian Murphy jawline, or I don't know who has a great jawline, Henry Cavill, like that kind of jawline. I'm just telling you to have like a little bit something, you know. Yeah, so if you ever think about that, I would love to do it, because I'm like, once it's like a painter, okay, an artist. Once they start painting a picture, they have a vision, okay? Don't mind the needle, it's okay. They have vision, and you wouldn't want another artist to come in and finish up your picture because they don't see the vision, okay? And I have a vision for you, for your face, your whatever is going on with the jaw, and whatever we have to do with the nose, okay? So, as I said, like the artist, but but I am a medical doctor. Okay, so you just have to breathe in and out for me again. It'll be okay. So breathe in and out. Good. Okay, yes, okay, I'm putting a little bit of pressure on that. I'm coming in from a different side. It's fine. Breathe in and out. Good, good. And now from the bottom, and this will be your last Masseter injection. Breathe in and out. Good. Well, you see, you did absolutely amazing. I am surprised how well you did, actually, given the last time you were a little bit of a you were not scared the last time. Yeah, that's what I'm going to say. Let's see. The effect will not be instant. We have to, with Botox, we have to wait for a bit before it starts working. But it should be okay. And just try to rest. Don't talk so much. I know, like myself, I talk a little bit too much. Yeah, wait a second. Yes, so I talk a little bit too much. That is why I have this job, because I just, and that is something you mustn't do for a little bit. I sometimes catch myself thinking, why am I just speaking to speak? So don't speak to speak, just be calm, just tell people, just like, not today, today I'm resting. Okay, so we can move on to the nose. Yes, we have it marked up quite well. You have like freckles on your nose, which can be genetic. It can also be maybe more commonly from the sun exposure. So you would have to really try to mitigate that, because we are not friends with the sun. The dermatologist, they even are foes with the sun. Yeah, maybe I am like, I like the sun a little bit more than the dermatologist, just because people get a little bit wrinkly and then I can help them. Yes, okay, so I have a different kind of solution that I will be injecting, because this is filler, that was Botox. So your nose, it has a lot of personality. Honey, maybe even more personality than you. No, sorry, I'm being a little bit mean. I just get a little bit ahead of myself. As I said, I talk a lot. Yeah, I talk a lot. I talk more than maybe I should be talking. Yeah, I'm sorry. It has a lot of personality. And we have the syringe again. And okay, let me disinfect your nose. Yeah, maybe if we decide you should maybe think about a nose job. Yeah, a nose job, it would be needle. The nose job will be beneficial for you. You are one of the people that I don't doubt that a nose job could do wonders for you. Yes, so please turn to the side. I just want to look again what I'm working with. Okay, so sort of like this prominent here, and then it is a little bit like dented up here. come in from this side like this. And breathe in and out. Okay. Oh, that's going well. And breathe in and out. Look at me. Look ahead to me. Okay. Right. Going from the front like this. So breathe in and out from the top, and breathe in and out. Okay. Good. That's great. Doing absolutely fantastic job. Doing a fantastic job. You will be absolutely stunning once we're done. Maybe we can then work with a more operative stuff like surgery or things that we would have to, put you under to maybe, as I said the last time, get a little bit of that lipo. Yeah, I would not recommend a BBL for you. That would be ridiculous. Yeah, but I could see you getting a nose job after the filler absorbs a little bit. But this might be just a temporary solution for your nose issues. Yes. So again, I'll go in for the chin and then I will let you go. Let me just write it down that we did what we did. This is you. Turn it around to write some important things. So we did the Masseter, and for the TMJ, TMD, and then we did the nose, which was a filler, and now we will be doing the chin. Also, I'll write down that I advised the patient to get a liposuction, yes, such a strange word. Also advised the patient to get a nose job done surgically in the future. Advised the patient to actually use skincare. And what do you think? Would you want to get a Botox in your this area as well? So maybe the frowning is less, the wrinkles from the frowning are less deep. Okay, so the patient agrees with getting Botox for frown lines. Okay, I love to hear that. Okay, I love to hear that. But we still have to work on the chin with the filler. So again, the needle. We'll draw some in. Some of the disinfect very quickly, and again from the sides, breathe in and out. From the top, breathe in and out. Good, you are doing amazing. You are starting to become a pro. Breathe in and out, and from the bottom, a little bit, lift up your chin a little bit. Breathe in and out. Good. Great job. As I said, you are starting to become a pro. You look very, let me just massage this a little bit. You look very natural in my opinion. Yeah, like very natural. It looks good. Nose. The skin is still flappy. The skin is still very dehydrated and very worth addressing with somebody like a dermatologist or the top with the water, you know, like the tap, like a glass of water. Yeah, probably with that as well. You should do that. Okay, so to go back to our little so what we did is your nose, your chin, and then the masseter. All right, and we did also the forehead, the crow's feet, and the under eye. All right, so that is, we have done quite a bit of work, and some work is still ahead of us. The frown lines. You see, when I frown, you can argue that I also get smile lines. You see, those are the very popular smile lines, but when I frown, you can see them as well. Okay, so we have to address all of those. I am very happy that you are doing so well with the needles. Okay, it's fine. The needle, it's skinny, a legend, and okay, the needle is skinny, and it just is. You are doing amazing. Okay, I'm very glad. But what I see is that you have a little bit of a like a mustache. Yeah, and I don't really want to work through that, so I would like to shave it a little bit. Yeah, don't worry. I see stuff like that all the time, you know. So we are just going to, I'm a doctor, I have seen worse. I've always seen worse. So I put this on. You have to think that a doctor, as a doctor, I have seen worse. These doctors see a lot of things. So may I just come in a little bit? Yes, thank you. So like that and that, just very quickly to get rid of any of this like dark and thick stuff, very lightly. Okay, good. So that's great. We will use the botulinum again. We are not going to, or the Botox, I'm sorry, I keep using the government name. I take another cotton pad. Again, you know how this works already. I'm just going to get a little bit of the disinfectant, and to mark it up so that we will go in here and a little bit in here on this side, and the exact same on this side, and a little bit on this side. Can you frown? So a little here and here. Okay. So let me disinfect this on this side. Okay, great. That's amazing. We are flying through this. Boop, and draw a bit of our solution. And just quickly administer. Yes. Frown. Yeah, you can do that quite well, yeah. And breathe in, and now be relaxed for me. Please be relaxed. Be relaxed, and breathe in and out. Okay. From the top, breathe in and out. Side, breathe in and out. And as I said, a little bit from this side as well. Breathe in and out. It's good that you're getting a bit more things done at the same time, because for some time now you will not say a thing. Yeah, you have to really keep it still with both the TMJ and the Botox, for your smile lines. So at least some people have a little bit of peace at home from it. I'm joking. You know, I'm sure you are amazing, but see, at least maybe you can think a little bit, you know? You can think before you speak. Well, you will not speak, but at least you can like think, and you don't have to say things all the time. We don't have to speak all the time to be liked. Sometimes we just have to think, have to be there, and we have to listen. You know, we don't always have to have something to say. Sometimes hearing someone out is enough. So let me just disinfect this. All right. Okay, good. So I'm coming out in from the top and breathe in. Can you frown again? Great. So can you breathe in and out? Good. Breathe in and out. Good. Now from the bottom. Breathe in and out. And then from the side, breathe in and out. Good. Very well done. Then I'm just... You are bleeding a little bit in here, so let me just get a bit of more of the disinfectant. So like this. Great, that's amazing. So that is done. You look a little bit irritated. Granted. Look a little irritated, but that is expected after such thing. You should be used to that in a while. So I'm recommending maybe next time we can address more things like the nose on a larger scale, or I would say we would have to address your jaw, but there is no jaw to be addressed. No, sorry, or jawline. You have a jaw, you have a bone. Okay, but we would have to sculpt it a little bit. Okay, so if you make up your mind that you want to do this or you don't want to do this, you should do it. Yeah, you should you should do it. Like we have seen each other for some time now, and you know that I don't want to mystificate you, but you should do it. Yeah, you should do it. It's not just for the money. It's honestly, it's just from the bottom of my heart. It's a recommendation. Yes. Okay, so I'll write down a few things that we have done. And the total that it comes up to. Okay. So we have done the smile lines and the frown lines. I mean, you know, then we did the masseter. It's a little, yeah, it's a little bit deeper. We did the chin, and then we did the nose. Okay, so that's it. That's it for today. You have done well, I have to admit. You're getting better at taking in those needles. It takes practice, but once you become a little desensitized to it, it's better. It's just a needle, piece of metal. It's fine, and you have done well. So thank you for collaboration with me. Today it'll be just light 8,000. Yes, again, you can send it to me. I'll be very glad if you send it to me. I don't take checks. No, I don't. So just send it to me, and hopefully we'll see each other at maybe the operating room, or again once you want to address, and maybe like a facelift or something which you would benefit from. go to the dermatologist, and that is it from me. Thank you very much for being here.